Let's turn to Jonathan Coleman now. He's the Minister of Health, the MP for Northcote, 50 years old. He's the youngest of the three. Head boy at Auckland Grammar. He studied medicine, worked as a doctor, gained a postgraduate diploma in obstetrics, then an MBA from the London Business School, having entered Parliament in 2005. He is the shortest serving MP of the three. Are you there, Minister?
Good evening, John. I am indeed.
Yeah, good. Nice to talk to you.
Yeah, good to talk to you.
Yeah. So, very distinct pitch from Judith Collins, and business as usual, but possibly with a longer leash from Bill English, right? I tried to pin Bill English down on tax cuts, and I think he's saying, well, this is something caucus has to decide and all that kind of stuff. Would you go ahead with the tax cuts? Because Bill English talks about how we distribute the dividends of growth.
Well, I tell you, I'm in my electorate office each week, and I'm widely involved in my electorate. I'm down at my local primary school. This is not an issue that people raise with me, and my strong feeling is we have to make sure that the health and education systems and infrastructure are properly funded first, but especially those social services.
So wait a sec. So forgive me, because boy, this is an important time to get clarity and to get people putting a stake in the ground. You're saying no.
I'm saying you'd really want to understand what you need to put into health and education to deliver on what, New Zealanders absolutely expect us to provide. And look, I think we've been doing a great job, if I might say so myself, in those portfolios. But there's always pressure in those areas. Things like education, access to special education, mental health. I want to provide more community mental health services. And those are the sort of things that people come into my electorate office in Northcote and raise with me. Those are the things that are important to them. They haven't raised tax cuts with me. Sure, if we had money left over, it would be good to do that. But I am very much in touch, because I'm out in the community all the time, with what's important to those people in the community, not only those who have voted for us for the last 8 years, but I believe the vast band of Middle New Zealand. So that's my view on it.
Okay, absolutely. You're representing yourself as a change candidate, right?
Yep, that's right.
Yeah, but can I respectfully suggest to you that you are in fact a sheep in wolf's clothing? I mean, I just wonder.
What the heck does that
mean, you opposed the Marriage Amendment Bill, gay marriage. You have a holiday house in Omaha, which is the same incredibly expensive beach as John Key. You have had, your CV. You just want to stand and clap when you read it. But I just wonder what experience you have of the kind of issues that are confronting New Zealand and which seem to have presented an Achilles heel to this government.
Look, John, I tell you, in my medical career, I've worked with a wide range of people. I've, worked out in Otara doing general practice. I've worked overseas extensively, providing healthcare services to low-income people. I'm down at my local primary school all the time. I'm educating my children in the state system. I mean, the fact that I've got a house in Omaha, that's irrelevant. It's, to draw that, inference.
Look, cheap shot.
I focus on what's important to my constituents, and that's what they're telling me.
Okay, and your constituents are Northcote is an affluent electorate, isn't it? And once again,
it's quite a mixed electorate. Actually, it was held by Labor for a long time, and I won it off Labor. There's a real mixture. There's over 300 Housing New Zealand properties within 15 minutes walk of where I live.
So the people in the Housing New Zealand properties, who I think we would all agree have just about lost any hope of ever owning their own home now, haven't they, in this city anyway?
I don't know about that, but look...
Really, what do you say to them about realising what used to be a fairly ordinary kind of New Zealand dream?
Well, you know what? It all comes back in the end to education and skills, and that's why this government's put a big emphasis on that, and aspiration and the vision that John Key has laid out. And I think one thing that's very important in this selection race we're having is we've got to build on the excellent platform that we've been working off for the last 8 years, but go on further, because we want to see all those young kids growing up in the Housing New Zealand area of Northcote, my electorate, succeeding and going on to have the sort of success that they can enjoy with an education system that's consistently and highly delivering for them. We've got a great education system, we've got a great health system, but we've got to make sure we're focusing on what's really important to the voters out there. And that's going to require new ideas, it's going to require new policies, and very importantly, John, in terms of the political side, a continual sense of regeneration.
Okay, what's your best new idea? What is your best new idea?
Well, this is the point I'm making. It's all about talking with the caucus, drawing on their views, and actually coming up with an attractive policy platform. But I'll give you an example. If you look at infrastructure, look, we've done a great job in infrastructure, roading, water, all the rest of it. But actually we need far more in the years ahead to build New Zealand businesses, make this an easy place to run businesses, and make the system more productive. Now, perhaps we can do, John, perhaps we can do something more inventive in terms of things like financing instruments. I mean, in Auckland, we need a cross-harbour tunnel. Can we wait 30 years for that like NZTA want us to? I don't think so. Why don't we look at what other financing instruments there might be to get that type of infrastructure? That's only one example. Built and up so we can get the country running at a level that actually makes it more productive and accommodates the growing population we've got.
Jonathan Coleman, Health Minister, and the third of the people who are running to be Leader of the National Party and Prime Minister. We've spoken to them all now, Judith Collins, Bill English and Jonathan Coleman. Thank you to them all, and may the best candidate win.